What stops bladder spasms caused by neurogenic bladder? Imagine your bladder as a storage tank that sometimes gets confused because the nerves controlling it are damaged. This confusion can cause sudden, involuntary contractions called spasms, which can be uncomfortable or even embarrassing. So, what helps calm these spasms when the nerves aren't working properly? Let's explore the facts. The most common approach involves medications that relax the bladder muscles. Anticholinergic drugs, also called antimuscarinics, are often the first choice. They work by blocking signals that tell the bladder to contract, helping to increase its capacity and reduce urgency and leakage. Examples include sulfonacin and hyoscyamine. These medications are effective for many people, but they can cause side effects like dry mouth or constipation, so doctors may try different options to find the best fit. Another medication class gaining attention is beta-3 agonists, such as mirabegron. These work differently by relaxing the bladder muscle through a different nerve pathway, offering an alternative for those who don't tolerate anticholinergics well. Sometimes, tricyclic antidepressants like imipramine are used because they can help improve bladder capacity and reduce spasms, especially in complex cases. When medications aren't enough, doctors might recommend botulinum toxin injections. This treatment involves injecting a small amount of botulinum toxin directly into the bladder muscle during a procedure. The toxin temporarily paralyzes the muscle, preventing involuntary contractions. The effects usually last between 6 and 8 months, after which the injections need to be repeated. It's important to note that some patients might need to perform intermittent catheterization afterward if the bladder becomes too relaxed to empty naturally. For those who don't respond well to medications or injections, neuromodulation therapies can be considered. These involve devices that send electrical impulses to nerves controlling the bladder, helping to regulate its activity. Sacral neuromodulation and tibial nerve stimulation are examples. These therapies can be effective in reducing spasms and improving bladder control over time. Another strategy is catheterization, specifically clean intermittent catheterization. This involves inserting a thin tube into the bladder several times a day to drain urine completely. Doing so prevents urine buildup that can trigger spasms. For some individuals with anatomical challenges, alternative catheterization methods are available, such as using a small tube created from bowel tissue that exits through the abdomen. In severe cases where other treatments don't work, surgical options may be considered. These procedures aim to create a larger, low-pressure bladder reservoir or bypass the problematic area altogether. While more invasive, surgery can significantly reduce spasms and improve quality of life for those with persistent symptoms. Often, managing bladder spasms involves combining different treatments tailored to the individual. For example, medications might be used alongside nerve stimulation therapies or catheterization. It's essential to work closely with healthcare professionals experienced in neurogenic bladder care to develop a personalized plan. Remember, there is no one-size-fits-all solution. Each person's condition is unique, and treatment effectiveness varies. Regular follow-up and adjustments are key to maintaining bladder health and comfort. If you or someone you know is dealing with neurogenic bladder and spasms, consult a healthcare provider to explore the best options for your specific needs.